Hi, good afternoon. My name is Muna Abdullah. I'm a health systems specialist working for UNFPA East and Southern Africa Regional Office. I would like to share with you UNFPA's experience in promoting respectful maternity care in East and Southern Africa region. To give you a little bit of background, for UNFPA, zero preventable maternal deaths by 2030 is one of the three corporate transformative results. As a result, we have a UNFPA regional program which ran from 2018 to 2021, which defined an output indicator on number of countries with guideline on respectful maternity care in place. And this is the first time we had at the regional level an indicator on quality of care, particularly on respectful maternity care. We have been monitoring mostly service availability of services, but in 2018 we recognized the importance of including indicator on experience of care. How we intend to do it in the future also is to improve access to quality services by following systems approach. For UNFPA, we have a pillar of program on preventing maternal deaths is on midwifery, and we have a number of midwifery-led programs. This includes strengthening midwifery program at primary health care, community and facility level, maternal and perinatal day surveillance and response, integrated care following a life course approach, preventing fistula, emergency obstetric care, access to basic and comprehensive emergency obstetric care, and the component which I highlighted in purple is the quality of care, which mainly focuses on respectful maternity care. UNFPA East and Southern Africa works in 23 countries highlighted in the map, and we did an assessment of the midwifery workforce in the region, and we have more than 125,000 midwives in the region. What we do at the regional level is build capacity of midwives on respectful maternity care using various forums. Example, this picture you see is in 2019, where there is an Africa Midwifery Conference which was organized in collaboration with International Confederation of Midwives. There was a specific training on respectful maternity care, which was a one-day, full-day training pre-conference, and UNFPA documented around 95 midwives have attended this conference. We have also interagency collaboration with the WHO and UNICEF offices for improving quality of care. And as you know, WHO have revised the intrapartum care, which has a component of quality of care and experience of care. And in that experience of care, we work closely on promoting respectful maternity care. We also contribute to the UN Special Report on violence against women, focusing on disrespectful maternity care. Policy guideline at country level, we support countries mainstream respectful maternity care in national guidelines. For example, Kenya, Ethiopia, Eswatini, and Namibia, setting a service standard. For example, when countries revise their antenatal care, we provide technical assistance to mainstream respectful maternity care on these guidelines. For example, Namibia has revised their antenatal care in 2020, last year. We do also pre-service and in-service training, such as EMOC trainings in South Sudan and Kenya. In Zambia and Malawi, we support midwifery associations to advocate for respectful maternity care. For example, they have annual celebration of International Day of Midwives, and different countries advocate respectful maternity care in different ways. There is also an opportunity where countries revise their curriculum, midwifery curriculum. We support mainstreaming of respectful maternity care. Ethiopia is an example. Lesotho, when they do gap assessment for the midwifery training, we specifically try to try to highlight the importance of respectful maternity care in these assessments. Zambia has done the midwifery curriculum revision last year, and respectful maternity care was advocated to be part of the curriculum. In Ethiopia, we also support to ensure that respectful maternity care indicators are regularly monitored through the health sector monitoring framework. And this is an example. They have managed to include one indicator on respectful maternity care for their annual health sector review. This picture is a panel of midwives from intergenerational midwife, a retired midwife, a young midwife, representing different contexts, having a dialogue, and these forums is used to promote respectful maternity care. Like we are doing also now, we join hands with like-minded agencies such as the East Central and Southern Africa health communities to promote respectful maternity care. And lastly, measuring respectful maternity care has been a challenge, but what we have done is at regional level, we developed a synthesis of evidence on respectful maternity care. So the challenge is some countries have a standalone national guideline on respectful maternity care, and others, they have integrated respectful maternity care into their national guidelines, such as reproductive RMNCH, reproductive health, sexual reproductive health national guidelines, or any kind of other trainings like EMOC training. So this is my last slide, and the next step is in this region, we know that respectful maternity care is, the awareness is there. Some countries are at different level, but the collaboration has to be strengthened. A lot of initiatives and efforts are in place, and this collaboration should be strengthened. Expand our intervention on quality of care. There is also a lot of emphasis on quality of care. Evidences are coming up that access to access to skilled birth attendants is increasing, but it's not contributing to reduction of maternal mortality, and the main reason given was poor quality of care. So mainstreaming respectful maternity care in this quality of care initiative would be an opportunity for us. Close collaboration with professional associations. We are working with midwifery associations, and others are working with different professional associations. I think this would be also a key to roll out respectful maternity care. Continue generating evidence and data to drive programs, as we are trying to do now. UNFPA regional office is developing its regional program 2022 and 2025, and we are planning also to really focus on respectful maternity care in the regional program. Thank you very much.